This animation shows a step-by-step guide on how to complete the pGALSplus assessment. All pGALSplus resources are available on the Paediatric Musculoskeletal Matters website at www.pmmonline.org. pGALSplus expands on the original pGALS assessment and includes additional skills that may help to identify children with underlying weakness, issues with balance and coordination, as well as pain and restricted range of movement. To begin with, record the concerns of the parent or carer, and also those concerns raised by the child or young person. Then ask the screening questions listed. The following information will guide you through the clinical assessment. Step 1. Ask the child to take their T-shirt off. Look for any difficulties that may be due to reduced range of movement in the arms and shoulders, or an inability to raise the arms against gravity. Step 2. Observe the child in standing from top to toe. Note any asymmetry, swelling, deformities, rashes, altered foot position, and also look at the alignment of the spine. For steps 3 and 4, ask the child to walk, then walk on their heels and on their tiptoes. Look at the child for any difficulties due to swelling, reduced range of movement, poor muscle strength, or poor coordination. Step 5. Ask the child to hold their arms and hands out straight in front of them. Look for elbow, wrist, and finger extension. Step 6. Ask the child to make a tight fist with their arms out in front of them, palms up. Look for the ability to supinate, and if the child's unable to make the fist, is this due to reduced range of movement, poor strength, or possibly pain? Step 7. Ask the child to pinch the index finger and thumb together. Look at range of movement and functional grip. Step 8. Ask the child to hold their hands out with fingers splayed and squeeze their metacarpophalangeal joints with your fingers. Check for pain. Step 9. Ask the child to place their hands in a prayer position, palm to palm, and then back to back, keeping their elbows horizontal, and look for any reduced range of movement at the wrists. Step 10. Ask the child to reach their arms up in the air and look up to the sky. Again, look for any reduced range of movement or an inability to lift the arms against gravity. Step 11. Ask the child to place both their hands behind their neck with their elbows back, and again check for range of movement or a weakness that may indicate an inability to move the arms against gravity. Step 12. Ask the child to tip their ear towards their shoulder in both directions and look for any pain or reduced range of movement. Step 13. Ask the child to place 3 of their own fingers in a stacked position into their mouth and look for any restriction in the TMJ opening. For step 14, the child will need to be lying supine on the bed or plinth. Feel for any effusion in the knees, look for any swelling, and feel for heat. Step 15. Ask the child to bend and straighten their knees one at a time. Check their active range of movement and look for any passive hyperextension. Step 16. Again in supine, check for any obvious leg length discrepancy and measure this if necessary. Step 17. Passively bring the knee and hip to a 90-degree angle and check the external and internal rotation at the hip, looking for any pain or restriction in range of movement. Step 18. In supine, check patella, ankle and plantar reflexes using a tendon hammer, checking for any diminished or exaggerated reflexes or any asymmetry. Step 19. In standing, ask the child to stand and bend forwards, reaching their hands towards their toes, keeping their legs straight. Look at the alignment of the spine, checking for any scoliosis or kyphosis. Step 20. Ask the child to lie on the floor in supine. Ask them to cross their arms over their chest and lift their head up to look at their toes. Look for any difficulty with this, side flexion or protraction at the neck and the head not being lifted in midline. Step 21. Ask the child to stand up from the floor from a supine position as quickly as possible. Look for any difficulty with this that may be due to pain, reduced range of movement, weakness, and possibly a poor understanding of the instructions given. Step 22. Place a small toy on the floor in front of the child and ask them to squat down to retrieve it and stand back up again. Again, look for any difficulty with this due to pain, reduced range of movement, weakness, or poor understanding of the instruction. Step 23. Ask the child to stand on one leg for as long as they can, and then repeat this on the other leg. Look for evidence of poor balance, the child trying to hold onto furniture or perhaps an adult's hand, any exaggerated arm movements, or difficulties due to weakness or pain. Step 24. Ask the child to hop on one leg across the room as far as they can and then repeat on the other leg. Again, look for any poor balance, holding onto furniture, exaggerated arm movements, and difficulties due to weakness or pain or poor understanding of instruction. Step 25. Ask the child to jump with 2 feet together 3 times forwards for those aged 5 to 6, or a sequence of jumps in an older child, and again look for difficulties, poor balance, weakness, exaggerated arm movements, and a difficulty understanding instructions. Step 26. Throw a tennis ball to the child and ask them to catch it and throw it back to you. For a child aged 5 to 6, they should do this 2 times with both hands together, and for an older child, 5 times with their dominant hand. Look for poor self-positioning, i.e. arms too far apart, inaccurate aim, an immature scoop catch, or difficulty understanding instructions. Once you have completed the assessment using the proforma, complete the scoring. There is a guide and some examples to help you with this. Also consider the use of the additional resources listed. All resources are available via the Paediatric Musculoskeletal Matters website.